Coming up on the Sky News Daily with me, Neil Paterson, weight loss drugs have taken the UK by storm. But now doctors are warning they could stop the contraceptive pill from working. What more don't we know? Love them or loathe them, weight loss jabs have been a game changer. People who've struggled all their lives trying to keep the pounds off find themselves living leaner, healthier lives. But now, a warning from the Medicines and Healthcare Regulatory Agency, or MHRA, the drugs could stop the contraceptive pill from working effectively. They've also acknowledged that it's not yet known if they're safe for unborn babies. Dr Nikita Kanani is a GP, a women's health expert, and former medical director for primary care for NHS England and NHS Improvement. Doctor, good to have you with us. First and foremost, can you just explain exactly what the MHRA is? What does that body actually do?
So the Medicines and Healthcare Regulatory Agency is the agency that looks at safety data and produces advisory guidance to patients and clinicians about the use of different medications. In this case, they have produced a report that looks at the safety data of the weight loss drugs that you might have heard about: Ozempic, Wegovy, Mounjaro. There's a range of them, and they're worried about the increased risk of miscarriage and birth defects in some cases.
And is this information that they have picked up from clinicians like yourself? Where have they got the data set that has allowed them to say, look, we're a wee bit worried about all of this?
So as clinicians, when we prescribe medication, we do report any adverse effects or any side effects on a particular platform that MHRA use, the yellow card scheme. It used to be actually pieces of paper, and now it's all electronically. So if I see a patient and they have a particular reaction to any medication, I would report it. And then MHRA looks at that across the country and comes up with recommendations for clinicians and for patients.
Is this something that you have encountered in your own clinical work? I mean, one of the things that has been discussed today in many of the news articles covering this is the increased risk of pregnancy that comes with taking these drugs. Is that something you recognise?
Yeah. So the increased risk of pregnancy, yes, absolutely. So it's really important when you're taking weight loss medication to have really good contraception as well. And actually, if you are taking a weight loss medication and you're of childbearing age, you should have effective contraception, and your healthcare professional should have that conversation with you.
But when it comes to the very specific warning about the risk of birth defects, is there an evidence base for that? Have we been seeing that out in the wild? Or is this just a case of the MHRA suggesting, look, we just don't know whether or not these drugs might have an effect on the unborn fetus?
Yeah, so it's the latter, Neil. So what we're seeing is a potential risk of miscarriage and birth defects in post-marketing cases, so after the medication's out there and being used, and in animal studies. Because the reality is, and this is a different conversation for another day, there isn't very much research, and there's not many trials of medication on women, let alone women of childbearing age. And so often medications are tested on men and then given to women, and we don't know what's going to happen. So there's an issue about how trials are conducted and how equity is managed through research. But in this particular case, there might be an increased risk of miscarriage and birth defects in some cases and in some animal studies.
So that is not to suggest that these drugs have in some way been rushed onto the market without having done the due process, so to speak, the empirical research that medicines need to go through before we categorise them as safe, in inverted commas, of course.
Yeah, absolutely. So look, these are drugs that have been used for a very long time, not for weight loss, but for management of particularly sugars in diabetes. So these are very, very common drugs, actually. The semaglutide and the tirzepatide, which is a little bit less common, but both of them have been used for a long time. They've been regulated, they've been tested.
Just to clarify a couple of points here. This is advice that applies to people taking these drugs for all purposes, first and foremost. So if you're taking it for diabetes or if you're taking it for weight loss, you should follow this same advice.
So what it says is, if you're pregnant or planning to become pregnant, please don't use this medication. If you're taking it and you become pregnant, stop the medication and speak to a healthcare professional. Now, often, if you are taking the medication for diabetes, you'll be in touch with a diabetes team, usually through your local GP practice. And these are conversations that you'll be very, very used to. If you're taking it for weight loss, you might not have a team that you're working with, because it might be an online sort of a pharmacy without a human in there, or not a regular human in there. Then if you are pregnant or planning to become pregnant, or if you're listening to this and you're worried, I'd say get in touch with the person who's providing it and have a conversation. Failing that, have a conversation with your registered healthcare provider, your GP team, so that you can figure out whether this is something that you can continue with or not.
But just to focus on the private purchasing of those drugs that you've just mentioned, much of which does take place through, well, I suppose it's not an entirely unregulated space, but it does take place through online pharmacies and so on. And this is a drug, as with every drug, that does have side effects. And when one is not sitting in front of a GP, as we are right now, even if only over a video call, and discussing those potential side effects, there is a risk to the user, isn't there?
There is, that's right. And look, I'm a fan of the rise of lots of online options, pharmacies, doctors, etc. And there's definitely a place for them. But these conversations do need to happen when you're trying a new drug. And particularly what I'm finding with the weight loss medications, because they're more accessible online, you don't need to go and see your GP necessarily to get it. People are taking them outside of the use case. So, there are some people who BMI, body mass index, isn't a great measure, but they'll have a relatively low BMI. They need to lose a few pounds for the summer, they say sometimes, and that isn't what these medications are regulated for. So, having that conversation, even if it is with somebody online, and saying, these are the reasons why I'm taking it, these are my risk factors, the other conditions I have, my family history, is a really important part of having this prescribed. And if you've been able to access these weight loss medications in an unregulated way, just take a moment, because yes, it might help with the weight loss, but you might have unintended consequences.
Is that the reason then that we are seeing these drugs being prescribed less through more traditional means, GPs like yourself, and more online, that people are trying to game the system? Or is it that the NHS doesn't have access to the drugs in the volume that they require?
It's a both problem, actually. So it is both the format and the fact that the volumes you'd need, and actually the cost on the NHS is quite prohibitive at the moment. However, of course, if we get the targeting right, so people get it at the right stage, actually the cost benefit is incredible, because of course, as people's weight go down, their cardiovascular risk improves, then actually they're going to be they're going to need the NHS less as they get older. So as the NHS makes the kind of economic case, which is strong, as it accesses more of this medication, I hope to see more people getting it through routine ways through the NHS, which also improves this two-tier system that we're seeing at the moment.
Let's speak more generally just for a second, Nikita. I mean, I've already described on the podcast these drugs as a game changer. I mean, is that your view? I mean, what utility do you see in them moving forward? Do you have any concerns about the growing, the almost widespread use of these drugs right now?
I agree with the term game changer. I have seen people struggling with their weight for so long. We are no longer of a society where it's calories in, calories out, and it's super simple. It's not. A society has changed. Our foods have so many addictive properties in them, not just sugars, but ultra-processed elements that mean that people can't manage calories in, calories out as we would have done even 10 years ago. So I am a fan of the medications in a regulated way, i.e. where people can look out for risk factors and side effects and reasons why they might not go on them, and then go on them in a safe way. We're also seeing some fantastic things coming out of early use of these for weight loss in terms of cardiovascular disease risk reducing, so heart attacks, strokes, etc. So there's some really, really powerful ways that these medications are going to make a long-term difference to individuals and to society. My concerns are very much about access. So currently, particularly in this country and pretty much globally, you can access these medications if you can pay for them. That means we are creating a further widening of this two-tier society where those that can afford it will be, healthy and well for longer, and those that can't won't. And so that's one of actually my biggest concerns. In terms of health and longevity, being well for longer, we do need to be live to advice like this from the MHRA, recognizing that this is how scientific advancement happens. If we only stick to the medications that were available 50 or 100 years ago, well, we're not going to be living any longer. So we do need to try new medications and regulate new medications, but it's also important to be responsive to guidance like this when it comes out so that we keep people safe as well.
Doctor, great to have you on the podcast. Thanks for your time. And of course, if you have any questions arising from today's podcast, as the good doctor said, your best port of call is your GP. You can also find plenty of advice and information via the NHS website. The Sky News Daily is back again tomorrow.